Thank you very much, Helen. It's a real honour to be invited to contribute to this prestigious conference. Thank you. And I'm a little bit nervous because I've been asked to share my reflections. And we've heard from David Whitaker this morning about there's no point looking back unless actually we can say how far we've gone. And also from Deborah Harding's work on awareness sharing. So what I hope to achieve is based on my own learning and insights and our collective achievement about where we're at now. So in the 20 minutes, I'm going to touch on these 5 areas, I hope. The journey from ACP to CP to consultant practitioner, that's multi-professional. The leadership, management and culture change challenges that we have. A focus on the concept of embedded research and the power of impact, looking at sustainability, particularly in developing the workforce, and ending up with a view on context and some key messages to hopefully help everyone to consider and build on where they're going. So the first theme then is very much about this journey. I understand the journey. It's about understanding the journey from those polar ends of advanced practice with the multi-professional pillars in relation to quality, and consultant practice and the scope of that role in relation to the quality of care that's provided to our communities in terms of health and social care. And at the advanced level, I would see that the main focus is on providing quality as a clinician to our patients and to our communities, and that the other roles one is developing expertise in, and some of our advanced practitioners have tremendous expertise in one or other of these additional roles. When we move on to consultant practice, and it is very much a journey, then the focus on quality is around the system. And if we really want to enable quality across the system, we cannot provide direct client care 24 hours a day. We have to look at how we integrate these key roles to address the needs of our localities and populations. I will say something about job plans a bit later, and I know that the themes that I share have been touched on already by all of the speakers before me. So currently, the multi-professional consultant practitioner framework focuses on integration of the generic roles, and I would emphasize and argue and endorse that the clinical professional role is unique to the profession, and it provides credibility in one's leadership role to break down silos and barriers across communities. But it's the other 4 roles based on a foundation of consultancy that is generic, and they lend themselves to multi-professional opportunities for learning. The next slide shares with you the findings from preliminary work that I've undertaken with Professor Rob Crouch to look at what the developmental pathway needs to look like from advanced practice through to the transition into consultant practice, and 3 years into consultant practice and 5 years into consultant practice. And I wanted to share this with you because it echoes many of the messages we've heard this morning, in that there would not be a course that you would go on to do a program to fulfill these criteria and capabilities, but it's about taking every opportunity that you have to work with others, to shadow others, to undergo development and improvement projects whereby you can really collect evidence that can be accredited in a portfolio approach, using the workplace as the main resource for learning and integrating that with development, improvement, and so on. I shall say a little bit more about that. Now, this pathway identifies the enablers and also the impact, and the multi-professional consultant practitioner framework itself has an impact framework. It's really essential that we consider impact, the difference that these roles make, and we prioritise that in our portfolio evidence. One of the key enablers, though, to achieving the potential of both advanced practitioners and consultant practitioners is really referred to in the next slide. And this slide really looks at the power of culture. So we know from all the work that's undertaken in any area of innovation or policy or development, that unless we attend to the culture of the workplace, we will not get off the starting block. And I would expect consultant practitioners in any of our professions to have expertise in the development of workplace cultures that are not only good places to work, but really epitomise the very best of practice that can support health and social outcomes. So this picture at the top shows you that culture can eat strategy for breakfast, dinner and lunch. And the second picture I often use to illustrate what a flourishing culture looks like. And we've heard also from David this morning about the focus on flourishing, how we help people to flourish and thrive, whether those are our staff and our workforce or whether it's our patients and our populations and communities. And at the bottom here, you have research that's been undertaken that is really key to understanding what an effective workplace culture looks like that's also a good place to work. It's identified by these guiding lights, and we've heard a lot about these messages this morning about how we complement each other as collective leaders, how we live our shared values, how we create workplaces where we can experiment because they feel safe, we can be critical, they're creative, they're learning environments where we can explore and inquire together, and that the focus is on change for good that makes a difference and addresses what matters to people. There is another similar research focus using the guiding lights metaphor, and that's one that we were asked to consider by the Burdett Trust to answer the question, how do we develop leadership in nursing, midwifery and AHP practice? And likewise, there are 5 guiding lights, but the whole focus of those guiding lights, because culture change is mainly dependent on leadership, and leadership that's effective is mainly dependent on relationships, building, connecting, seeing the lights in other people, using those lights to connect. So moving on to the next slide then, which is more about the research pillar, and I should emphasize that the pillars, the invisible pillars, are all integrated, and it's that is the powerful bit, the integration of all the pillars. So on the next slide, a small slide here, before we get into the research pillar, it's really important that we are embedding research and not just doing research. And 20 years of research on knowledge translation has highlighted the key variables that impact on this in practice. The ability to triangulate, to embed, to blend different types of evidence that prioritizes what matters to people. The ability to work with the context, which includes the culture that I've talked about, leadership, which I've talked about, and the evaluation focus, evaluation that's more than audit, that uses multiple sources of data available to us to understand what's happening. And the last factor is the facilitation expertise, using the workplace as the main resource for learning, developing, improving, inquiry, innovation, knowledge translation, blending all those activities together. And that approach to facilitation is not project management. It's about holistic facilitation that's focused on the needs of people and that is person-centered. Now, I want to introduce the concept of embedded research, but before I do, I'd like to share this slide with you, which you will be very familiar with if you've studied education or reflective practice, Donald Shon's, about highlighting the technical high ground and the very swampy lowland. And the sort of research that we need to do in advance to consultant practice is around the swampy lowland. And by their nature, it is messy and complex. But it's here that the research is most needed, because so much research isn't even implemented. But it's here that we most need to focus on what matters to people, and we need to focus on using the workplace as the key source and focus of our research, as well as asking curious questions about the areas that could be improved, that tie in with our local objectives, our local population needs. So embedded research, you'll become familiar with, is a key concept, and it's talking about research in and from practice. A big National Institute of Health Service research study over the past 3 years has focused on this concept, and I was one of the case studies in this research in my previous joint appointment as a joint clinical chair between the NHS and the university. Now, this research has shown the potential for embedded research. It's taken a range of different models, some of which are bringing in a researcher in resident type model. But when we think about advanced practice and consultant practice, we're talking about growing these people in the workplace, or using our consultant practitioners with this expertise in the workplace to address those swampy lowlands. Now, the NIHR study showed that there are 3 types of skills that are required as an embedded researcher. And this again endorses the need for all of the pillars being integrated to support practice. The first set are the topic-specific skills, which will be about your professional expertise, whatever that profession is. Note that I use the term expertise rather than expert, because expertise donates dynamic expertise in practice, in the doing, in the practice area, rather than technical expertise that might be within our head. The second type of approach is the methodological skills and expertise, to be able to choose the right sort of approach that's going to answer the questions that you need to address. Much of my background has been in participatory action research, appreciative inquiry, realist evaluation that focuses on what matters, what works, what doesn't work in the messy context of practice. And this sort of a connection between all of the skills, the interprofessional skills, the research skills, the facilitation skills, all of those skills underpin the multi-professional consultant practice framework. And they are endorsed in this piece of research here, the Venus model, which brought together a number of research studies across practice in different contexts to identify the key skill sets that are required to sustain person-centered transformation across our healthcare systems. And that is the practice development skill set, because of the collaborative, inclusive and participative approaches, the person-centered values, a systematic way of developing practice, the culture change that I've alluded to, the facilitation skill set, the improvement and innovation skill set, as well as I think I've got more. I think I might have missed one there actually on my slides, and which I'll move on. But tied in with it, all of these skills, is the ability to
over the past 12 months,
is the ability to co-create with people. So co-production is absolutely key to the embedded researcher agenda and to the consultant practitioner role. Co-production with our colleagues and workforce, with the stakeholders, with our citizens and patients. And we need to aspire to achieve the top levels of the co-production ladder, which focuses on true co-design and co-production with people rather than on them. So moving on now to the quality and safety issues, because quality and safety is linked with research and can complement research. And has to, if it is going to be used as a foundation research, we need to understand the difference between them and how they complement each other. So this slide here argues that quality and safety projects, they improve the local context and services, and they would be key to the role of advanced practice and consultant practice, but they only contribute to the research agenda if they are placed within the context of the literature and what is known about the subject already, and that they also add to the body of knowledge through systematic inquiry. I was aware of a number of safety projects in my own organisation previously that were really, really innovative, but none of them had actually looked to see what was already in the literature, and they could have saved so much time if they'd done that and then were able to build on it and then add to the literature in terms of their insights. Now, I've already talked about the messy context that we work in, and this slide here argues for that, because the context in which we're working, we need to blend different types of evidences to meet the needs of service users across our localities, and that is blending knowledge translation, knowledge mobilization, co-production, innovation and research, as well as learning, development and improvement. And this slide here shows on the left hand side, this little cartoon, that we implemented the same program in 2 locations, and for some reason we had a very different result. But that is because contexts are different and we need to understand what the contextual readiness factors are. This applies very much to getting the context right for building on the potential of advanced practice. And I would see that consultant practitioners, particularly in England, where there is going to be an integrated system shortly, they need to be at the commissioner level so that they can capitalise on the potential that advanced practice has and grow advanced practice opportunities, particularly in the community. Co-production, as I mentioned, is key to that, and also the global movement about what matters to you. And that's what matters to our citizens, what matters to our patients, what matters to our staff, and what matters to our students. All of those are really key. So I mentioned the co-production ladder earlier, and it is those top rungs that we need to aspire to work with now and not put that off, because the opportunities to work with citizens and with stakeholders really will enable us to get the services right. And that skill set is what I would expect of a consultant practitioner. So moving on to the last couple of slides. The last focus is on facilitation practice. Now, facilitation has a link with what we heard earlier around supervision, and in essence it's about helping people, individuals, teams and systems to achieve their purpose through holistic facilitation. And it's about integrating all of those functions in the workplace, using the workplace as the main resource for learning, because we cannot afford to take people out constantly for days and days and days. We need to be much more flexible and adaptive, but we need those skills in the workplace. So the presentation we heard about growing those skills, the education skills in advanced practice, is absolutely key to doing this. So to explain the complexities of facilitation, I've got this complex next slide. So if you look at the vertical axis, you're looking at the scope of complexity. It moves across this graph from facilitating individuals in terms of competence and capability development, facilitating learning in and from practice, facilitating inquiry about practice in practice, facilitating knowledge translation, facilitating clinical supervision and peer support, facilitating learning development and culture change, improvement, development, innovation. That's increasingly complex. And on the horizontal axis, really going from facilitating individuals through to groups and teams, organizations and systems. And those ideas in boxes on the right hand side show the sorts of programs that are run to enable those facilitation skills and those other skills to be developed. So many of the consultant practitioners I've worked worked with are now facilitating organisational clinical leadership programs or aspiring consultant programs, so that they're using their expertise to enable many others in different professions. So integration of the pillars is a key, and it's blending your expertise and growing expertise in all the pillars so as to achieve the requirements of your local population and what matters to citizens in partnership with them. So job planning we've heard a lot about, and I suppose I might be very controversial here. I think job planning should be job planned for clinical sessions so that the service knows how many sessions they have to access you. But because of the nature of the other pillars, it is really important that there is flexibility in the remaining time to work in an integrated way, to address the needs of the service, the needs of people very, very flexibly. And those do not lend themselves so much to job planning. So I would want to see much more flexibility and instead a focus on impact, the achievement of impact, so that people understand what impacts they're trying to achieve and that they're also able to demonstrate them. So finally, the take-home messages then really are, first of all, to keep your values and live them, living them being the harder aspect. Know your assumptions about knowledge and be transparent about your biases and focus on impact. Co-create with others, shared direction and ways of working through collaboration, inclusion and participation. And expose your ideas and work to critique, welcoming and enabling a culture of feedback. But finally, it's follow your passion with persistence and tenacity. That is what's going to see you through, and you will eventually get there. Thank you so much for listening.